Welcome everyone here today. Thank you very much for taking the time out to join us. My name is Rob Pacheco. Sorry that it says Dennis Costello here. That's our RareConnect project leader, whose account I'm using. But my name's Rob, and I'm a community manager with eurordis. So we first met the people that you're going to hear speak today online and began talking about creating a community on RareConnect for Castleman Disease. And after a few months of kind of going back and forth and putting together some materials and some stories, we wanted to show you that new international community today and invite you to join. So I'm going to tell you a bit about the Castleman community for a few minutes. And then Jim Johnson is here, and he's going to talk a bit about the International Castleman Disease organization. Then we got Greg Pacheco from CARE, the Castleman Awareness Research, and then David is here from the Castleman Disease Collaborative Network to fill us in as well about the community and all the activities. So a big welcome from everybody, and thanks a lot for being here. RareConnect is a social network and is a project of eurordis, the European Rare Disease Organization. Eurordis is a non-profit charity organization based in Paris, which is a federation of rare disease patient groups. One of the projects of eurordis is RareConnect, to create social networks for different rare diseases. Here on this slide, you see the community homepage at rareconnect.org. So RareConnect has been in existence since 2010, and we now have about 54 communities for different rare diseases, most recently for Castleman disease. We build communities in partnership with patient groups, and so that's why you have these guys here today to talk to you about their patient groups work and their vision for a global kind of Castleman community and global communication. But just to let you know that there are other networks on RareConnect as well that are trying to advance rare disease patient groups goals in the same way. So we get overall about 60,000 monthly unique visits from 170 countries, and that's across all of the 54 communities. We receive about 2,500 member visits per month, and each member is spending about 12 minutes on the community, reading stories and interacting with people across the language barrier. Over 6,000 stories, forum posts, questions, comments were added in 2013. And we're looking forward to continuing to grow the project this year in 2014 to add about another 10 communities. So what sets RareConnect apart, or why is this network and this group different? Working together. So we want to work with all of the Castleman groups in the world and work with all the people who might be living with the disease and isolated to try to connect them to the patient groups, to support to people in similar situations who can understand them. So we believe in a collaborative approach to moderation and to building an international community here, because that's the only way we'll push things forward in rare diseases, I think. Breaking down borders. So we have human translation on the new Castleman community on RareConnect. So there's two kinds of translation. First of all, when you see a post in a language that you don't know, you'll have the option to translate it instantly by Google. So there's a post in French, and you can translate it to English right away in one click. Or if you want, you can request a human translation of that post. So that'll be sent off to our human translation network. So that person may be living in France or maybe in Latin America, writing in Spanish, can be able to read your messages in their language and to be able to understand clearly what they're saying in your language. through the human translation. So that's something we're excited about for many reasons, and we hope that you can use the community to share your experiences on living with the disease, which can then be translated into other languages, which can then be found by other people who can really benefit from that information. So there you'll see when you click on the link to request human translation, this is the box that will appear. So you just need to confirm that you want that translation, and it gets sent off to our translators, and that's a service that eurordis fundraises for. So we're also connecting people with similar experiences across languages. This is from another community, but you'll see the original post is written in French, and then the response is written in English. And that was because the text was translated by a third-party service. So those kind of conversations we hope to enable. So for people living with the disease, for caregivers, for patient groups, for anybody who's interested in kind of creating and maintaining global knowledge. Quality. So some of our moderators are here today. There's Jim's picture. So along with myself and my colleague Marta from eurordis, we'll be moderating the community, helping to answer questions and helping to make sure posts are appropriate in the forum, so that you can trust the information that you get there on the community, and it's been reviewed by these people who have quite a lot of experience and knowledge about Castleman disease. So what's next? I want to encourage you to sign up on the Castleman's community, the Castleman disease community. You can add basic information to your profile. You don't have to, share your full name and address and city and details like that. You can just put a first name and the city where you're from, but perhaps say how you're connected to the disease when you were diagnosed, or which one of your loved ones has Castleman. You could introduce yourself on the forum. That would be really nice to get to know each other there, and start to make those connections across language that we saw. You can share your story through your profile, and I'll show you just how that looks in a second. And you can make friends and send private messages in the members section. So there's my email, and there's where you can find more about the RareConnect project and the Castleman community. I just want to show you the community live now in a few screens, if I can. And then I'm going to turn it over to Jim, who's going to tell us a bit more about his work over the years on Castleman disease. So I'll just share my screen here. Hold tight with me for a second. Great. So this is the Castleman disease community homepage. You can see there's the URL there, rareconnect.org, Castleman disease. Here is my profile. So we encourage you to put some basic information in there. You don't have to share your email and your full name like I did. Or here in the members section, you can see where other members are from. So you see ranging from Australia to United States to Argentina so far. That section is only viewable to registered members. Through your profile, you can tell your story, and then those stories go here in the member stories section, and are translated automatically across the 5 languages of RareConnect. So if you talk about your diagnosis and your treatments, or how you're coping with some side effects, then that can be translated and really help other people living with the disease as well. This story was added yesterday by somebody who already joined the community. So it's an interesting story, and I hope just the first of many to come. So come on over to the Castleman community and read that news story. So if you have any questions on registering, again, you can just send me or any of the moderators an email, and we'll take care of that and have everything fixed up. So that's all I have to say to talk about the Castleman community on RareConnect. And now I'm going to throw it over to Jim, who's going to talk some more.
Thanks, Rob. I wanted to thank Rob for this opportunity first to address the international community through this connection. For the last 20 years, I've been on the internet trying to find information that was relevant to Castleman Disease. As you know, the information was hard to find. So I started out developing a database of articles, personnel, and locations that we could track for information on Castleman Disease. It ended up being almost a full-time job. And at one point it became international. There were just as many cases international as there were national in the United States. We're now in, I believe, 23 countries. I've got cases that I've spoken to from all over the world: Russia, Yugoslavia, England. One of the things that's very interesting is I'm finding hotspots for Castlemen in different areas of the United States and internationally. Hotspots meaning there are large clusters of patients in these areas. For what reason, we don't know. I was diagnosed myself with Castleman Disease over 20 years ago. I had a single node in the chest that was caught with a routine X-ray. Further investigation said that it was Castleman Disease after they took after a needle biopsy was inconclusive, and they took tissue, and it came back Castleman. It was a highly vascular mass near the heart, attached to the sphenic nerve. If anybody's familiar with Castleman Disease, you know that the Castleman Disease needs a food source. So being next to major arteries, organs, and as such, you're going to run the risk of having that risk. So that's normally where you're going to find the nodes in the chest, neck, abdomen, and pelvis for routine scans. My surgery, I had 2 surgeries. And the second surgery, what they said was the majority of the mass. Since then, I've been unremarkable with no further recurrences of Castleman Disease. And the Unicentric disease seems to be the mildest, with the multicentric being the more aggressive type of Castleman disease. I've been taken, within the past 2 years, my doctor says that I have not had a recurrence, so I do not have to go back for x-rays or MRIs or any of this, partially because of my age, but the other reason is the doctors are concerned about so much radiation exposure when you're having CTs and MRIs every year or every other year to make sure that there is no recurrence of the disease. So I would suggest that people contact their surgeons and make sure that, or their doctors, and let the doctors know how many MRIs or CTs that you had, so that if there is a concern with that, they can monitor the disease. Well, that's all I have.
Okay, thanks very much for that. Next, I think Greg wanted to say a few words. Can't hear you, Greg.
My name is Greg Pacheco, and I have Castleman Disease also. I'm a patient. I was actually diagnosed in June of 2004 with a HIV-negative multicentric variant of Castleman's disease. So it's handled a little bit differently than what Jim has experienced, but he knows as well as anybody else the troubles and difficulties of treating this very complicated disease. I'll just tell you a little bit about myself because that kind of leads into what work we've been doing. I actually first started experiencing symptoms of the disease in March of 2003, so it took over a year for me to be properly diagnosed with Castleman's. And then once I was diagnosed, it was just as difficult, if not more difficult, finding treatment for Castleman's disease. I was lucky enough to find Jim Johnson and his ICDO website, and my mother actually contacted Jim by phone, and he referred me to Dr. Van Ree at UAMS in Little Rock, Arkansas, which was my savior. I had been on a treatment there. At the time, it was in a clinical trial, IL-6 receptor antibody protocol, and we had success with that, and I've been on that treatment ever since. From 2004 to 2012, I had to travel back to Little Rock for regular treatments. Now that the drug is finally on the open market, I can get it locally from my physician here in California. Early on, after I was first diagnosed, we realized how difficult things were. Jim was doing a lot of great work, and he had a lot of information out there for patients and resources to get patients to the right place and to be treated correctly by a doctor who knew about the disease. But what we did find was there wasn't a lot of research going on, laboratory research, or there wasn't many doctors that were, really aware of this disease and especially on how to treat it. So we started a nonprofit 501c3 organization called Castleman's Awareness and Research Effort, also known as CARE. And we started having fundraisers here in California locally. We were talking to Dr. Van Ree at UAMS. They had a desire to start a research laboratory exclusively for Castleman's disease. So it was our goal to provide them with money to start that laboratory. So we, every year we had a, pretty substantial fundraiser. We started donating money to UAMS, and then finally in 2000. April 2009, they officially dedicated a laboratory for Castleman's disease research. So that was their primary goal of that lab, is to conduct research for Castleman's. So that was CARE's first goal, first and foremost, and we still continue to provide funding for that laboratory, but now we've kind of shifted our focus more into raising awareness, which is part of our mission statement also, and reaching out to other individuals that are wanting, that have the same goal in mind. And that's why we're here today. And this is, something that's been important to myself, more importantly to my wife and my mother and my family. And I think, many people out there are in the same situation, and, and we are, we all kind of have the same goal in mind. So that's a little bit about CARE. And yeah, that's all I have to say for now.
Great. Thanks very much, Greg. That's really interesting to hear kind of how your thread connects to Jim, who's maybe been diagnosed the longest, and maybe now we'll let Dave kind of talk about how he's also connected to everybody here too, and is working on some interesting things. Dave?
Great. Thanks so much, Rob. As Rob said, I'm Dave Fagan. I am involved in this. So I wanted to just share a little bit of info about the CDCN. This is back in August 2012. We started working on it. It was myself, some colleagues at Penn, and then and also Dr. Van Ree, and Greg has been a huge part as well. So this is back in August 2012. We said, okay, what do we need to do to advance our understanding of the disease? What do we need to do to cure Castlemans? And we felt like the most important thing was to promote collaboration. And so the first thing we did was build an infrastructure. We said we need to assemble all of the world's experts onto this scientific advisory board to set the agenda and determine research priorities. 2, we needed to bring together the full community. Not just the experts, but anyone who treats Castlemans or is interested in Castlemans research. 3, we needed to develop a global agenda. What are the most important studies that need to be done? What is going to get us over the edge? What is going to help us to understand this disease so we can cure it? And then the last piece is to fully engage the full patient community. Incredible leaders like Greg and Jim and those of you who are on the call right now to get together to take this disease on, because for many of us we have a ticking time bomb in some sense. We have a clock, and to extend that clock and to be around for a lot longer, we need to take this disease over, and we need to beat it. So over the last year and a half, I wanted to share some of our key accomplishments. So the first is that we've assembled the 23 world's experts on this scientific advisory board. We've organized a couple meetings at the American Society of Hematology of these world's experts, plus additional experts as well. We had about 30 attend our first year in 2012, and we had over 50 attend last year. What's really exciting is the motivation by these doctors. So many of you guys know Castleman's is poorly understood. It's not easily treated, but those physicians that do treat it, they're very passionate about figuring this thing out, because unfortunately they've had too many experiences with patients that haven't done well or haven't made it. And so they are incredibly motivated to take this disease on. Third, we built a database of the physicians around the world treating Castleman, and we created an online platform for them to communicate to advance the science. Fourth, recently, just in the last month, I've published a comprehensive review article on Castleman disease, saying what do we know today, so that way we can figure out what we need to figure out tomorrow. And then lastly, we developed a global agenda. What needs to be done? What are the research studies that will advance our understanding so that we can cure this thing? And so I wanted to share some of the projects that we have for the next 6 months or so. The first is to launch a website for the CDCN to share information about the disease, how physicians can get involved, how patients can get involved. 2 is building a global patient registry. So we're working currently with UPenn and also with a pharmaceutical company that's been a great supporter of the community to try to establish a patient registry, because that will advance the science. 3, we need to establish diagnostic criteria for Castleman disease. It's very difficult to diagnose, and one of the reasons is because there isn't a clear criteria for how to diagnose it and how to treat it. or we need to fund those high-impact research studies that I was talking about. We've identified what they are, and the next step is funding them so that we do figure out this disease and we do cure it in the next few years. And then lastly, it's raising those funds to execute this research plan and to cure this disease. So listed a few ways that you guys can help, and we'd love to get these patients together to fight back. As I said, we will take on this disease and we will solve it, but the only way that we can do that is by joining together the full community and all getting behind this. So the first is getting involved with our team. We've got about 10 volunteers who we all put in tons of time to try to figure this thing out. We've got people focused on research, on collaboration, on awareness raising and fundraising. So let us know if you want to join and if you want to be a part of taking this disease on. 2, become a Castleman's Champion. And so this is something that Greg and I came up with over the last year, this concept of us all getting together to fight back. And Castleman's Champions, we're building out the program right now, but essentially it's just a platform to be able to reach out to friends and family and say, hey, I'm a champion, and this can be patients or loved ones. Say, I'm a champion, I'm going to take this disease on. And then 3, raise awareness when the website gets launched in the next couple of months. Tell your friends, tell family members about it. And then also please share the review article that I mentioned. I'll post it to this group. I think it's actually already posted, and happy to share it with anyone you think's interested. Along those lines also, please feel free to pass along my email address or any of your physicians' email addresses to me so that I can add them to our data. Just saying, please feel free to share my email address with your physicians or share their email addresses with me, because just as I hear Jim saying, it's so crucial for physicians worldwide to be engaged in knowing what is the cutting edge research, and also for us to be able to make sure we know who those doctors are out there so we can make sure that you all go to the experts.
And so if a physician wants to join the network, the physician network that's going on online, how can somebody help you to, how can somebody help connect their doctor to your physician network online?
Sure. So so the easiest thing is just to shoot me an email, and that's david@castlemannetwork.org. That's probably the easiest thing, and I can post it here. You shoot me an email, then I'll reach out to that physician, send them info about what we're doing, and then you'll also notice this on the right on your presentation, the online platform. And so this is a place, it's really parallel to this RareConnect community, where physicians and researchers communicate about the most up-to-date research and the most recent articles published and the most important studies to be done. And so I'd be thrilled to invite that physician to be a part of the community.
Okay, so that's pretty easy to kind of get your specialist and doctor involved, or at least aware of the networking and opportunities out there. So that was pretty much all you had to say, David, or did you have any more slides?
Yeah, I don't know if you guys heard me talk. Maybe the last thing, I don't know if you heard me talking about the images at the bottom of the slide. The image on the left is the initial Castleman photo that I could find, yeah, as you can see, it's a pretty wimpy Castleman. And for those of us that have gotten beaten up by Castleman a few times now, I think the drawing on the right maybe is a better representation of this guy Castleman. But it's also, I think, going to serve as our logo, our icon for this idea of Castleman Champions. And we're taking this thing on. We're not going down without a fight.
Great. Well, and we want to help. I think that creating this doctor network, combining and having the patient groups continuing to work together, And now with the launch of international patient community on RareConnect, we can start to really gather knowledge globally about the disease, hopefully, whereas maybe before it was, fragmented and a little in Australia and, an expert in Little Rock. We want to start to put together those experts, but also put together those experiences of all the people, that are here on the webinar today that have survived the disease. Because that's gonna be the information that helps other people, continue to fight, I think.
Okay. I was just gonna comment on how important it is for patients and family members who may know someone or have been involved with Castleman's disease is to get involved. As we know, Castleman's is a very rare disease, and there isn't any global organizations out there, really promoting it. And the most effective way to, promote the disease, raise money and all that stuff is for you to get involved in your community. And it's very effective when somebody knows someone personally who's been affected with something like this, and you can really make a difference. So the biggest thing you do is get involved. Bring awareness to your own community. There's a lot of local newspapers and everything that would like to kind of report on this, and everyone has a story, and the story is very similar, and it's very impactful. Other people are looking at it, and and so the biggest thing is you get involved, let people know what this is all about, and how they can help.
Great, Greg. And do you have any kind of ideas for fundraisers or ones that you've done, examples that you've done in the past that have gone well?
obviously I'd be raising money for, and then that's where I think that's the key, and then it opens up the door to a lot of other things at that point.
Thanks, Greg. You mentioned a lot of really good and creative ideas there, and I'm sure that's something that people can kind of follow.
Yeah, I do, Jim. So I shared with you the Blood Journal article that that's coming out now, and of course, Blood will get that data to almost all hematologists around the world. So that will be very helpful. I'm also working on a paper right now with some colleagues here at Penn that's a systematic literature review of all published cases of MCD in the world. And so this will give a good snapshot for what we know about the disease right now. So yes, you're absolutely right. Those are important publications that I'm working on, but I think much more important than those publications are the research that we're sparking right now around the world that has to be done. So to Greg's point about the importance for research, we have such a rare disease that's so poorly understood and treated that we have an opportunity to where we can actually move forward and change the science and change treatments available. And if we don't, no one will. So it'll continue at the pace that it's going at. But we have a real opportunity by raising money and getting involved and talking to doctors and speaking to researchers to literally accelerate that pace. And so it's not just that the money will just go to research that we don't understand. It'll actually specifically go to those projects that have to be done to advance the science. So we have a real opportunity here, and I think an opportunity, but also in some ways a responsibility. There's a lot of us around the world struggling, and we've got to figure this thing out. And it's not that Castleman's hasn't been figured out yet because it's so complex. It's that it hasn't been figured out yet because so little time has been dedicated to research. So we've got a real opportunity here, which is really, really exciting. There are new research labs at Ohio State, Cornell, here at Penn that are starting to do research. There are a lot of people who want to cure and solve diseases. They just need to know what those questions are that need to be asked. So we're working on that. So we need everyone's support to get involved. The other couple things I would share were that, to Jim's point, so there's a physician at the University of Cincinnati Children's Hospital, Shan, and I forget his last name. I can get that to you. Who is seeing pediatric cases? I think he's seen 13 cases in the last couple of years. So I'd be thrilled to share his information with anyone who would like that. And then the last thing I'd share is that we're here to help you with putting on events. So I mentioned that we've got some volunteers that are on our team Most of us either are in some sort of graduate school or have jobs, but we all really care about this cause, and so we're here to help. If you want to put on an event and don't know what it's going to, shoot me an email and someone will help you, whether it's to go to an event that already exists, like a bike ride and raise money for Castlemans, or to put on an event in your community. No matter what it is, we can help you, and we're going to work on building templates, toolkits, steps that you can go through, so that you can be a champion, so that you can be a part of taking this thing on. And the last thing I guess I would share is that this is a disease that is pretty relentless. It's something that we don't have a cure for it yet. Unfortunately, patients do relapse often. And so we really need to be relentless too in our fight, and we need to just keep fighting and keep pushing back against this thing. Because like I said, we have a real opportunity to do that.
And I think David Underwood had a question if there was a partnership ongoing with Arkansas Children's.
I have never been in contact with anyone from Arkansas Children's.
Okay. So that was just a question there. And Terry says yes. Docs need to recognize it better and be willing to send or talk to a specialist. Yeah, that specialist referral is really important, and I think these guys here can help put together those connections, make those connections happen. I think you have three really dedicated guys here that want to help people living with Castleman and want to help fight it, like what's been talked about today. So I hope we can all kind of stay in touch. I hope we can do a webinar like this again, like the great idea Jim had, kind of Castleman in young adolescent populations, or whatever else. So if you could register on the Castleman community on RareConnect, share a little bit about yourself on your profile, on the forum, or as a story, like some people have done before. All of us here on this webinar today are moderators, so we'll get email notifications when you ask your questions, and do our best to answer them if we can. One last question that just came in: is there anyone in Germany that is specializing? Anybody here aware of physicians in Germany?
I don't know. I don't believe there is one in Germany. I can check. I've got contacts in Germany, but I don't know about a Castleman doctor in Germany.
Okay, the person says, or Europe too. So I'll just tell them to send me guest two, the person asking this question. There's my email. If you could send that to me, I'll try to work with the guys on the call here today to try to find a name in your area, and we can do that through email. So I want to thank everybody here for coming and listening. And I want to thank the guys here for presenting. I think you did a great job to kind of talk about what's happening in Castleman now, and more importantly, how people can be involved.
And I want to certainly thank you, Rob, for all that you've done. This is really exciting that we have a patient community like this, and we are incredibly grateful to have someone like you putting this together.
With a lot of pleasure. And myself and my colleague Marta are just an email away. If something comes up about Castleman or something comes up about the community or anything, please send us an email. So I'll leave the room open here for a while if anybody has any final things to put in the chat window. But I'll kind of shut off the video and stop the recording now. So